Now I would like to showing the torso for the presence of the liver. Liver is the present in the abdominal cavity. First, this is the thoracic wall for counting the ribs. We know the liver can extend up to the 6 ribs. This is the 7 ribs and the 6 ribs. So this up to this region the liver can extend. This is the costal margin. That is the right costal margin and the left costal margin. And we know the liver can cover mainly the right costal margin, and it also extend to the and our abdominal cavity. The it is subdivided into the 9 regions, and these 9 regions is divided by 2 vertical line and 2 transverse line. The vertical line is now this is the clavicle. From the mid clavicle to the mid inguinal region, the first mid clavicular line, and the right side and left side 2 mid clavicular line from the clavicle, and the 2 transverse line. We know there is a 7, 8, 9, and the tip of the 9th costal cartilage, and there present the umbilicus, the Gifford process. This is the Gifford process, and this is the umbilicus. In between there is a first transpyloric line. This is the first transpyloric line, and second this is the iliac crest and the tubercle, the second transtubercle line. So 2 transverse line, transtubercle, transpyloric, 2 vertical, right and left mid clavicular line. By this the abdominal cavity is divided into the 9 regions. First, this is the right hypochondriac region, epigastric region, and there is a left hypochondriac regions. And the middle, there is a right lumbar, umbilical, and left lumbar. And this is a transtubercle line. There is a first iliac, right iliac, hypogastric, and left iliac. Now we remove the thoracic wall and showing the abdominal cavity. Now this is diaphragm. So this below the diaphragm, this is the abdominal cavity, and above the diaphragm, this is the thoracic cavity. The abdominal cavity, our main focus is the liver. So first we showing this is the diaphragm which can cover the liver. So superior surface, also anterior surface, and right lateral surface. And this is the inferior surface. There is a surrounded by the different organ. This is the stomach, and this is the colic flexure. And when we remove the liver, then we showing the structure are present there. This is the colic flexure, and remove the stomach, and also this is the duodenum. There is a duodenum, and there present the duodenum. We call it transverse colon, right colic flexure. This is the ascending transverse colon. This is the transverse colon. This is the ascending colon. So there is a right colic flexure, and this is the duodenum, and this is the pyloric part of the. And this when this organ is also removed, then we can showing the posterior structure. Posterior structure, we know there is a related with the both right side, right suprarenal gland close to the inferior vena cava. There is a right suprarenal gland, and this is the kidney, right kidney. Okay, the right kidney, right colic flexure, right kidney, right suprarenal gland. These are relation with the inferior surface of the liver, and also they are present in the posterior surface. This is the inferior vena cava. Now I hold the liver and showing their different gross and that is general feature and also the special feature. Now first I hold the liver in anatomical positions. In anatomical position, first points, there is a group. This is the inferior vena cava. This inferior vena cava lies most vertically. So most vertically it lies, and the right lobe of the liver, which is larger, we know, and it is more dome shaped and upwards than the left lobe. So this is the right lobe. It is slightly upward, and convexity upwards, and this is the left lobe. And inferior vena cava, the group for the inferior vena cava, which lies vertically and present posteriorly. So this is the anatomical position. First point, group for the inferior vena cava. Second point, right lobe is slightly upwards, convexity slightly upwards than the left lobe. These are the points for hole in the anatomical positions. Now showing the what are the lobes present. We know there is a anatomically by the attachment of the peritoneal ligaments, they are divided into larger right lobe anteriorly by the falciform ligament. This is the right lobe and left lobe, and also superiorly. But in posterior inferiorly, the right and left lobe is divided by two fissures. And posteriorly, the right lobe is divided by the fissure. This is the fissure for the ligamentum venosum, and this is the ligamentum teres hepatis. These are, for this reason, the caudate and caudate lobe anatomically included with the right lobe. Now the left lobe. Left lobe is present on the left side of the falciform ligament, and also posterior inferiorly they are divided by the fissure for ligamentum venosum and ligamentum teres hepatis. And this lobe is thin and have a form apex. It extends up to about the left hypochondrial region, just middle to the midclavicular line. Now the surface. What are the surface present in the liver? Now the anatomical position. This we know there is a surface from right to left, anterior surface. This is the anterior surface, and the wedge shaped most laterally the right lateral surface, and the superior surface. This is the right to left convex, concave and convex, concave and convex. This concavity, which is related, we know that is the cardiac region. And these are the both three regions we mentioned before. It is the diaphragmatic surface. Now the posteriorly from right to left, this posteriorly. Most important structure they are present. It is known as the inferior vena cava. So they have a group for the inferior vena cava. And now the inferior surface. Inferior surface from right to left. This is the inferior surface. The different visceral impression is present there. For this reason, it is also known as the visceral surface. So this visceral surface, if we showing the different impression from left to right, first there is a impression is the esophageal impression, that cardiac, stomach, gastric impression, and this impression is end. There is a caudate lobe, above the caudate lobe, below the protarpatis pyloric part, and along behind there on the left side, that is the from the left or right side, they are present duodenal impression, and the right side from downwards to above. First is the colic impression, right colic flexure, then the right renal, right kidney, right renal, and close to the inferior vena cava, they are present the suprarenal impression. This is the different impression on the inferior surface. Now we are showing about the peritoneal relations. So first there is we know there is a two-fold of the peritoneum from the anterior abdominal wall. This is known as the falciform ligament, and the lower end of the falciform ligament free, they contain the ligamentum teres hepatis, and it extends upwards, and the superior surface it diverges to the right and to the left. On the right side, it merges with the right coronary superior part of the coronary ligament, and on the left side it is merged with the left triangular ligament. And these coronary ligaments, superior and inferior, both are comes from the diaphragm. So right coronary ligament and inferior coronary ligament, they can fused on the right side and form the right triangular ligament. So in between there is a space which is uncovered by the peritoneum, so known as the bare area of the liver. And the posterior and the inferior surface, posterior inferior surface, the inferior coronary ligament, they can extend the groove for the inferior vena cava, and on the fissure for the ligamentum venosum, this is the protohepatis, they can merge with the lesser omentum, and also the posterior triangular left triangular ligament, it is also done goes downwards through the fissure for the ligamentum venosum and merge with the lesser omentum. So that's all today. See you in the next class. Allah subhanahu wa ta'ala save you and your family. Allah Hafiz.